Every human being will have some type of back discomfort, either in the hip or the sacroiliac. But the sacroiliac is the most common problem for low back pain. And that's what I want to show you today, how you can fix it, how you can release it, and how you can take away that irritation or that pressure you're having on that nerve. So I'm going to show you a couple basic anatomical things so I can point it out to you so you understand what is happening in your own body. Then I'll go through several different techniques that you can do. You can pick out those that work best for you, but I guarantee you, you will see great results. And here's something that will help you naturally without drugs and anything else that can be invasive to your body. Well, here is the sacroiliac joints. This is where the sacrum meets the ilium, right in that joint. You have two of them, on the left and on the right. These are your lower lumbar spine. These are the nerves, the yellow things that come out between the vertebrae. These are the discs between the vertebrae. And when people hold their lower back, say, "Ow, my hip hurts." No, your hip is out here. Here's your hip joint. Your hip is not back here. Your hip is off to the side. But what happens is when the sacroiliac joint locks, remember, everything we do, standing, walking, bending, twisting, lying down, it all moves in here. And if this joint becomes locked, we say it's fixated, that will cause problems in other areas of the spine. Maybe in the hip, maybe in the lower back, maybe in the buttocks, maybe going down the leg. You have nerves that come out down low called the sciatic nerve, and this nerve comes out underneath the buttocks, down the leg. It can cause burning, tingling, numbness. It can go all the way down to your foot. And people who have had sciatica know what it's like. But most sciatic problems down the legs do not come from herniated discs. They come from problems in the sacroiliac. So, are you ready? This is going to do wonders for you. Let's get moving. And one of the greatest things we can do when it comes to our pelvic, our lower back, are the iliotibial band. IT band, tensor fascia lata, TFL. There's a band that goes from the hip all the way down and crosses the knee. So when you sit down, I like you just to take one knee and just pull it over. And you're going to say, "Wow, I feel all that pulling." You have to release these tight bands in order for the sacroiliac and the pelvic to move properly. If this band is overly contracted, it's going to fixate. It's going to lock up that pelvis. It's going to affect your gait. It's going to affect your walking. This can cause a lot of your lower back problems, just pulling it over just like this. And the piriformis muscle, just crossing it like this, leaning forward to your foot like this. You can push this knee down a little bit. You'll feel all that stretch on the opposite side. You can do that 30 seconds, and then you can cross the other side. Putting pressure on the knee joint, opening it up as you lean forward towards the foot, you will know what I'm talking about. That will take a lot of pressure off that piriformis area to help unlock the pelvis. Now, here is one of my favorite exercises. So here's what I'd like you to do. Get on the floor on all fours right in front of a couch, whatever is at this level. Let's say it's my right side, right here. Right there, it's hurting me. What I want you to do is put your leg up on the couch 90 degrees at your knee, just like this, whatever's comfortable. And what I'd like you to do is twist your body slowly away from the couch. Use your hands. You'll start to feel it open up right about here. Wow. And what you're going to do is you're going to lean a little bit more as you go down. Oh, hear that? Right there. Open up that sacroiliac joint. If you do the left side, put the left side up right here, just like this. And then you'll walk yourself around. I'm feeling the tension coming out that sacroiliac joint. And as you come around, you'll feel that nice release. Right in that SI joint. Try it. You'll like it. Now you can lay down on a floor, your bed, anywhere else you like. Here's what I'd like you to do. Two things. We're going to rock the pelvis to open the sacroiliac even more. You're going to go ahead, keep your knees together, bend it like this, 90 degrees, and you're going to rock from side to side, just shaking the pelvis, just like this. You can go nice and slow. I want you to do this for a good minute or so. And after this, what you're going to do is you're going to straighten the legs out. Then I want you to rock your body side to side. Don't move your legs. Try to twist the best you can. You're going to feel it all in that sacroiliac joint. You're going to feel all that movement come back. Just twist side to side. Do that 30 seconds to a minute. Take your time. You can do it longer if you like, but just twist side to side. That's the key, to get that movement in there, to free up those tight muscles. And this is definitely going to help you feel much, much better. Now go ahead and flip over, get comfortable, put your head on a pillow, lay on the floor, wherever's comfortable. It could be your bed. What I want you to do is put both knees at 90 degrees like this. And what I want you to do is I want you to put pressure, resistance against your knees. And I want you to go back and forth just like this. And as you hold that pressure with your knees and just resist back and forth. This is going to isolate the muscles around the sacroiliac joint, deep in the pelvic area. Do this for about 30 seconds. Just put pressure and force. When you come back, resist it with both hands. Now I want you to put your both legs down, take one knee up like this. And what I want you to do now is that you're going to take your left hand and you're going to push on that right knee. You can go ahead, you can put your arm back here. Then what you're going to do is you're going to bring this up as you continue to press on that right knee, work on the left side. You're going to bring this up and just touch your knee. This is it. Keep that resistance on that right knee. It may be a little sore, maybe a little harder for you. You can relax them both if you want. Go back up on there, take the other hand, resist this knee, pushing as the knee's coming back. Keep that knee with resistance against that hand. And then you're going to go ahead and bring this up just like this. As you open and close, keep that pressure on the knee. It takes a little bit of coordination. This is going to help your pelvic significantly as you lock out and isolate those muscles as we free up that sacroiliac joint as well. And by the way, I want to make sure you're sleeping correctly. You want to make sure that your head is properly positioned, not too high or not too low. And you'd preferably be on your back or your side. If you're on your side, put a pillow between the knees. If you're on your back, put a pillow underneath the knees. And if your bed is too soft and saggy, that can definitely be a problem. You want to make sure that you keep the spine in line. That's very important. So utilize these exercises. I promise you, you will see great changes. It's safe and very effective. This is going to free up that contracture, that tightness, that restriction that's probably causing your pain and problems. Remember, this is going to release that sacroiliac joint. It's going to help the hip joint. It's going to help your lower back. It can help your discs. It can help the pinched nerve as well as sciatica. So utilize these whenever you need to and refer them out to a friend because you'll be doing them a big favor. Please leave your comments below and most important, make it a great day. I'm Dr. Alan Mandell.